Welcome back to the Dr. Jeffrey Tauth Heart Talk Show. Today's show is called Dr. Jeffrey Tauth, our heart murmurs decoded and demystified. And trust me, it's juicier than your cousin's peach cobbler. So you're sitting in your doctor's office, everything's going fine, and then bam, they hit you with "you have a heart murmur." Suddenly your palms are sweating, your mind's racing, and you're wondering if you should start writing your will. But what if I told you that most heart murmurs are actually harmless whispers your heart makes naturally? Yep, entirely true. I can't make this stuff up. Let me break this down for you because I see people panic about this every single day in my clinic. A heart murmur is simply an extra sound your heart makes between beats. That's it. Think of it like your heart going whoosh, instead of just the regular lub dub we all know and love. It's caused by turbulent blood flow through your heart chambers, kind of like when water flows through a kinked garden hose and makes that whooshing sound. Here's the kicker. Most people have murmurs at some point in their lives. They're often discovered during routine checkups when your doctor's listening to your heart and goes, interesting. That sends everyone into orbit, but honestly, it's usually about as concerning as finding out you have brown eyes. Now, before you think I'm being cavalier about heart health, let me explain the difference between innocent murmurs and the ones that actually deserve your attention. Innocent murmurs are harmless. Think of them like background music your heart plays. They're incredibly common in children, pregnant women, and when you have a fever or you've just finished exercising. Your heart's working a little harder, blood's flowing faster, and voila, you get some extra sound effects. Concerning murmurs, on the other hand, suggest there might be structural heart problems that need evaluation. The key difference is this. Innocent murmurs don't cause symptoms or limit your activities. You can still chase your kids around the yard, climb stairs without gasping, and sleep flat without feeling like you're drowning. So when should you actually worry? Here are the red flags that make me sit up and pay attention. If you have chest pain, shortness of breath, or you're fainting, especially if these happen with your murmur, maybe I should see you in the clinic. We need to talk. Blue lips or fingernails, particularly in children, that's not normal. Sudden changes in exercise tolerance where you used to run upstairs and now you're huffing and puffing after 3 steps. If you have symptoms with a murmur, see a cardiologist immediately. Don't wait, don't Google it for 3 hours, just make the call. Let me tell you about Sarah, a 28-year-old marathon runner who came to see me last month. She discovered her murmur during a routine physical for a new job. The doctor mentioned it casually, but Sarah heard heart problem and completely panicked. She stopped running, avoided stairs, and spent weeks convinced she was one heartbeat away from disaster. When she finally came to my office, I could see the fear in her eyes. After a thorough examination and some tests, I had great news. Her murmur was completely innocent. She'd probably had it since childhood, and it had zero impact on her health. The turbulence was just from her incredibly fit heart pumping efficiently. Within a week of our conversation, she was back to training for her next marathon with complete peace of mind. This happens more often than you'd think. People put their lives on hold because of innocent murmurs, and that's just unnecessary suffering. Here's your actionable takeaway, and I want you to remember this if you ever hear those 2 words, heart murmur. Ask your doctor these 2 specific questions. Is this innocent or pathological? And do I need any activity restrictions? Those questions will give you everything you need to know about whether you should worry or just get on with your life. The bottom line is this. Most heart murmurs are about as dangerous as having freckles. They're just part of how your unique heart works. But when in doubt, get it checked out by someone who knows what they're listening for. Your peace of mind is worth the visit, and your heart deserves the attention. This has been the Dr. Jeffrey Tauth Heart Talk Show. Until next time, stay healthy, and remember, if you're looking for answers, check out drjeffreytauth.us.com. Later, y'all.